I seen on the presentation I'm presenting on civil unrest in South Africa. There's just a bit of change in that civil unrest in South Africa due to the fact that we're still busy collecting our data, and I'll present that hopefully at the next conference we have. What I've decided to present is an African story, a journey through Africa's largest NGO. The reason I've decided to present this is when you think of Africa, you basically always think about the beautiful images of Africa, but also in Africa, we've got these images here and other images which you've seen by Dr. Khalik from NSF, which is presented in front of us. These are also the images you will get in South Africa. And Africa, my reason for putting this is to bring you what Africa is doing for the world. Always when you hear about Africa, you always hear how much aid we're receiving in Africa, how much funds we need in Africa. So I want to tell you a story of how Africa is doing for Africa in the world through an NGO. Okay, this is Gift of the Givers Foundation is the NGO. This NGO is the largest NGO of African origin. We've delivered aid in 43 countries all over the world and 1.8 billion rand of aid. This NGO here, the aid that's delivered is medical supplies, search and rescue, humanitarian aid. And what we've come on the concept now recently is we've developed a concept called Beyond the Rubble. So meaning wherever we go to any country of disaster, we would like to leave back a legacy there, so a hospital or shelter for the people, is not to just make it a primary response and come back after 10 days. Okay, the NGO was formed in 1992 by the instruction of a Sufi sheikh in Turkey who instructed the founder, Dr. Imtiaz Suleiman, that he should form an NGO that would benefit mankind and serve whole of humanity unconditionally. Unconditionally meaning all different religions, it doesn't matter of your social class or where you come from. Dr. Imtiaz Suleiman was a medical practitioner, and in 1992, after coming back from under the instruction from the Sufi sheikh, he formed the NGO Gift of the Givers Foundation. And the motto that was given for this by the Sufi sheikh was Khairun Nas Man Yafun Nas. Best among you are those who benefit mankind. And Dr. Imtiaz Suleiman, he gave up his practice and established the NGO in Durban, South Africa. When he arrived in 1992, this was his first mission as the NGO, was the Bosnian War, which Gift of the Givers started and responded to. Now, coming from a country like I always say it's a South African NGO, but we represent Africa. So coming from an African country, I mean, think about Bosnia. In 1992, we thought how we would respond to this war in Bosnia. But through the establishment and networking of the donors and the support of the people in South Africa mostly, we as Gift of the Givers, this is just some bombing of the war that was there. We as Gift of the Givers developed the first containerized mobile hospital. And this hospital here was compared to any other leading hospital in the European or Western world at that time. So in 1992, we sent all of this aid through to Bosnia for the war. Can you imagine sending a whole containerized hospital from South Africa right through to Bosnia? In this containerized hospital, you'll see we had different compartments, and this is now old technology, but at that time, this was latest technology. We've established X-ray containers, we had the pediatric ICU units, we established burns units, and offices for administrative buildings. This is just some. The hospital, because of the war, if you look at that picture, you're just looking at a rundown site or bombed up building. But the containerized hospital was put underneath that building which you see there to function. This hospital here could do basically every type of procedure besides cardiothoracic surgery. This is just Imtiaz meeting the president at that time there. The Gift of the Givers Foundation, we consist of plus minus 450 volunteers at the moment, coming from all different specialities, disciplines. So from primary healthcare, surgeons, to search and rescue, to trauma counseling afterwards as well. And all the volunteers that come with us are volunteers. They don't get paid for this. They all volunteer and come from all different walks of life, all religious places. Our next mission when Gift of the Givers started, it's evolved from the Bosnia right through. So through the 43 different countries we've delivered aid. I'll just take you to a journey through some of the countries where African NGO has done for Africa and the world, as I said. Somalia tsunami in 2004. What Gift of the Givers response in this was that when the tsunami happened, what happens normally with the world? When a tsunami happened, everyone goes and responds basically to the nice holiday resorts or places where you get a lot of tourists in it. But in Africa, when it destroyed Hafun in Somalia, no one responded, and Gift of the Givers looks at that aspect, where this NGO says, let's go to areas where the world will not respond. So in Somalia, we were the first NGO to respond here through to Somalia. You can see the devastation in this one village. And in this village, this was due to the tsunami. This was a fishing village. Everything was destroyed in this village. On our response, we presented and we delivered humanitarian aid, and that's how we flew all our volunteers over through to Somalia with all the aid. And what we also did here is Gift of the Givers gave the village 150 boats so people can start reliving and start getting their source of income back, because it's no use. That's where I'm coming with the term beyond the rubble. You go there for 5 or 10 days, or the teams go, you do the work for 10 days, but what do you leave back for the community or country that you've went to? And we said that beyond the rubble is the way to go. After now, we maintain the boats in Somalia, we get feedback in, we've sent now last year another 27 boats through to Somalia. This is our medical teams just at work. We've also built a medical center in Hafun, and it's functioning up till today. Our next journey I'll take you through is to Niger, the famine. When the famine hit in 2005 in Niger, we flew our team. You can see we fly the team's first class. Those are all volunteers that come with us. So all the 8 goes first class there. In Niger, no one wanted to respond as well. So we entered the country and we were greeted by the presidential team there, delivered quite a lot of aid in that country as well. This is just some images from the famine and the drought in that country. Our medical teams working. And then this was my association with Gift of the Givers, and my first mission with Gift of the Givers was the Pakistani earthquake in 2005. This was the devastation that the earthquake caused. What caught me on this mission was the following. As we arrived in Pakistan, and the people in Pakistan looked at us as we landed at the airport. They seen a South African team. We are a mixed team, all different colors, different races. And when we told them we're here from Africa, they told us, what do you want? So we told them, we're not here for what do we want to assist you. We're an African team. And that's where we've seen that people always look down on Africa. And what was interesting is there was a hospital called Cantonment General Hospital, which was this one. It was going to be decommissioned by the Pakistani government. What they've asked us to do is they were going to shut it down. We decided and we said we will commission this hospital, give it through to us. We took in our teams, and while everyone was going through to the mountains, we decided to stay in Islamabad, and our team started working to the people that needed medical interventions immediately. From my personal experience in disasters as well, when you go through to disasters, a lot of teams do this where the medical teams will go out and will try, especially search and rescue. So search and rescue teams will go out and you want to find live patients. The question we took and what we experienced is, what about the patients who have survived? The early intervention is going to make the difference in the end of the day, because if you look at success rate of finding people buried under the rubble compared to living people, it's going to be much more better to treat people that are injured already. So focus also a lot of your attention on the injured patients first. There's just some pictures of the establishment we had there. Like I said, our teams are consisting a lot of all different disciplines, from orthopedics, neuro. This is one of our nurses that has assisted with rehabilitation. So with our disaster response, what we've done is we provide, I always tell the people, we provide an A to Z service. So what happens is, we'll send in our search and rescue teams, and we have our medical teams that follow. We set up the field clinics or hospitals. After that, we deliver humanitarian aid, and then also we rehabilitate a building, and then we send rehabilitation trauma counseling teams to assist as well. This was our response to the Gaza war in 2008 to 9. So some images. And that's some images there where we've taken also ambulances through to Gaza. This is part of our trauma teams that have went. And what we've done also as Gift of the Givers is, in certain countries, one of them being Palestine, we've done a memorandum of understanding now between the different institutes where we share skills, and we've sent now lately our urologist over, and he'll teach, and we share skills between the two countries as well, and the two NGOs whenever we assist. Haiti was another big mission for us as an African team. The 2010 earthquake in Haiti was quite devastating, as everyone who has watched it have seen. This was the first time where we sent a search and rescue team that was aided to Gift of the Givers Foundation. In Haiti, the same concept. As we were there sending our search and rescue teams, we also aided doctors to our search and rescue teams. So when the search and rescue teams are doing their rapid assessments and trying to remove people from the rubble, we had our medical team setting up clinics and had to begin that primary intervention, which would save lives in the end of the day. This lady here was Ena Zizi. She was rescued by the South African team after 7 days being buried under the rubble. It was the first time in history that an African team had ever pulled out a live person in the rubble, and that made headlines in the news. But most important was to show the world that Africa is doing something for the world as well, and Africa can do it. Images of Emma and Azizi. Also, all our, what was interesting also with South Africa or African medical specialists or surgeons or any other discipline in the medical field is, we are trained to work under, like how Dr. Khalid has said, difficult circumstances. We are faced with trauma, we are faced with a lot of different types of epidemics, pandemics, and we make things work, we can adapt. And that's what we also seen in Haiti with the teams. The Western teams were actually saying, if you need something done in Haiti, go to South Africa, the Dream Team, they will do it for you. What's very important with us as well is, all our medical specialists that come, we also fulfill that part where we go through their portfolios as well, that they fill the ethical side of things, there's dignity, they're treating the patients properly, and we have follow-up care. Whereby what we found in a lot of teams is, especially in Haiti, is a lot of teams were doing amputations, and what happened is they did the amputation, no follow-up care, the amputation got sepsis again and had to be re-amputated. So imagine what you're putting the patient through again. And that's why we said, if you want to do this kind of work or respond to international disasters with the team. Dignity is very important in professionalism, and you need the right person to do the right work. In Somalia, we responded through to the famine 2011. The world also said no one can go into Somalia. It's a terror country. It's you're being bombed and stuff. And Gift of the Givers responded again into Somalia. We flew 28 planes into Somalia of humanitarian aid in the 2011 famine and drought. What we're showing you here is the people lining up for primary health care. This is our medical center which we set up, all the medical specialists that come with us. If you look to the pictures, you can see all our teams are all mixed teams, but that's the spirit of what we call in South Africa Ubuntu, the spirit of togetherness. This is just a picture of our team. Some of the patients we were treating there for the famine. A hospital was established in Somalia in 2011. And till today, the hospital is still up and running in Somalia, where we get feedback daily on the cases that are done in supplying aid till today. In Africa, you can ask Dr. Khalid as well, a thing like oxygen is a luxury in the country. We actually had to take in our own oxygen into Somalia because there's no oxygen in Somalia. So imagine the patients that you have there that are undergoing emergency treatment or in theater, there's no oxygen. So things we take for granted, it's a luxury in those countries. This is just pictures of the hospital. It's our pediatricians, gynecologists. We responded to Republic of Congo. There was an explosion where they had an arm factory in the city. I don't know who puts an arm factory in the middle of the city, but the explosion erupted and our search and rescue teams were in, where we took also medical specialists through, set up our field hospitals, and we also took trauma counselors. We responded through to the Mozambican floods as well, where we work a lot with the government and the defense force. Also, Gift of the Givers approach to international disasters is we work with the government. You don't come and take over a country you are in. So when you come to a country, you always fit in with them and respect the country and the dignity of the people and the laws of the country, which is very, very important, which we learned through our evolving more than 20 years. These are just images of some floods. In 2013, we responded to Syria. We all know the Syrian crisis and what's happening there. That was our transport from Turkey into Syria. So it shows you, again, like how Dr. Khalid has said, this NGO work when you go, that's a neurosurgeon in the pot, if I can put it, an orthopedic surgeon crossing the river from Turkey into Syria. That's the risk you will take. There's just images. In Syria, in 2013, which Gift of the Givers established a hospital in Darkush, which is running till today. This hospital here we have in Darkush is being funded by the foundation since 2013 up till today. We've got another hospital as well there in Syria, and all the 200 staff that are there are funded by Gift of the Givers. And this hospital here is doing life-saving operations, procedures daily related to war injuries, mostly in Syria. The hospital was, they tried to bomb the hospital a few times, but Allah's mercy, it was not bombed, and it's still surviving and delivering life-saving medical interventions. Just that's a maxillofacial, our obs and gynae, that's our anesthetist. Dentistry is also something we took through trauma surgery. There's some images. The hospital in Syria is Al-Rahma Hospital. In 2013, the Philippines typhoon, we also responded. Once again, we looked at where people didn't go. Everyone was responding to a place called Tacloban on the Leyte Island. We looked at a place called Palom Pont, which was on the Leyte Island. Our teams also responded there, and this is just some of the devastation. When you look at this hospital here, this hospital didn't look like this. The whole first floor was devastated by the typhoon. What Gift of the Givers done was same the Beyond the Rubble approach. We rehabilitated the whole top floor, theatre, painted the hospital, and got it commissioned again. Just our teams working. In Zimbabwe, our search and rescue team is also doing wilderness search and rescue, and all of these, all volunteers going through. In Gaza 2014, we were going to send a big contingency through to the war zone, but were only allowed 10 medical personnel who are all specialists from orthopedics to vascular surgery, neurosurgery, pediatric ICU, maxillofacial, that assisted in the 2014. We've also assisted in the Al Wajah hospital to rebuild it, just our teams working. And what Gift of the Givers has been doing now in Gaza is we're building this rehabilitation childcare center, which is being built by the foundation to assist the people of Gaza. Nepal earthquake, we responded in 2015 as well. Our teams went through to Kathmandu and the outlying areas to respond. Just some images of our teams working. Our dentists out for primary health care. What we've also delivered there in Nepal was humanitarian aid and shelter as well. To conclude my presentation, I just want to explain, since we're all in disaster management, you know, the beyond rubble approach is very important, especially if you go to other countries, like I've mentioned before, to leave something back, a legacy, but to follow up as well, to know what's happening about for the patient. We looked at it in the way that if something happened to me, I would also want to know, or something happened to my mother or brother, I also want to know how they're doing, follow up, care on them, are they getting the right intervention, and are we bringing that ethics and human dignity back into the person as well. Also, what's very important is you should also respect countries that you go into, assist them where you can, and fall into their systems. And you should have no political affiliation, it should be about humanity. And I think that's very important, whereby also a motto we live by is things are done through you and not by you. And once you adopt that kind of outlook into life as a medical personnel, you actually do things properly from your heart, basically, if you can put it, man. Thank you so much. Apologies for not presenting on the earlier subject, but I just thought this is relevant, and to give Africa a positive light as well, and to show what Africa is doing for the world and where we are and where the volunteers are coming from to serve humanity. Thank you.
Thank you, Dr. Ahmed Bham, for enlightening us and giving us an insight to the current condition in South Africa. Now, it is time to invite the next speaker, Dr. Abdullah Alshimemeri, to give his talk on terrorism attack and riot challenges in Hajj.